it brings awareness, first of all, to the member states that do not have radiotherapy, and those member states that have radiotherapy equipment but still inadequate, or sometimes they could be having radiotherapy equipment and it's not in good working order.
Well, I think the AGaRT platform, the fact that it brings together all the stakeholders that are related to the mission, which is basically increasing access to radiotherapy and hopefully changing the map for the world map, so that we have more of the greenery countries that will have access to radiotherapy for the treatment of cancer patients.
The advantage, single most advantage is this is a common forum to understand the requirements of all the LMI countries. A lot of people who've been brought in from the demand side, the people who need this equipment to be run, and the people who can supply this equipment. So this is a common forum where the requirements are understood, and then that is going to help us in actually making the requirement being met in a very comprehensive manner.
So we sitting like in a dialogue manner and see what we can do or what functionality we can obtain without increasing the cost, but still having a reliable and safe radiotherapy. So I think this is a unique platform in that sense that you have a manufacturer and the end user basically sitting and discussing how to reduce the cost and how to make the thing sustainable.
So far as at now, we have reached a stage where we have identified what we are calling a basic package for establishing a radiotherapy center. And this basic package includes guidelines from planning, the design of the building, and then actually the type of machines that you should have as a first entity, and also touching on the issues of installations, acceptance testing, commissioning, and finally transitioning into a clinical service.
So the first output was that there was defined processes and terms which can help to low and middle income countries develop radiotherapy in their territory.
In the long run, so what we'd like is that to make a more affordable packages from the companies, so they will have a better equipment or the cheaper manufacturing processes, because we are facing a shortages of 5,000 units, which is a very huge, and maybe they can reduce the cost by increasing the number of units producing. So there is a certain ways how you can do that.
The major achievements of AGaRT, as can be seen now after the 5th meeting, is a consensus between all participants, all stakeholders to the radiotherapy topic, a consensus resulting in draft guidelines already that give direction and guidance into what needs to be done, into the most important actions to get these things done.
We have the personnel, we can give a lot of training, we can provide information, documentation, machine and everything, and we are already prepared for that. Okay.
This acted as the first step toward the so-called next generation of AGaRT, whereby we tried to bridge the gaps that we were missing, whether from the stakeholders' point of view, the financial institutions and other professional societies and whatnot, so that we can hopefully come to the implementation stages, including setting up some pilot projects for the AGaRT system.